Good morning, Caldwell. It's Dr. Field with Prime Sports Med. Today for our Doc Talk Tuesday, we're actually going to be going over what to do for an acute injury. I'm going to use an example of an ankle sprain because we've all rolled an ankle before or sprained an ankle. And a lot of the times, a lot of the questions that I get are, okay, well, what do I do? The common thing is the Rice method, which came out in 1978. It's not that it's outdated, it still can be used pretty well, but we're just going to kind of go over the details of Rice, but also a new fun acronym that's super long called Peace and Love. So with the acute injury, the Rice method, the first thing we want to do is rest. That's the R in Rice. So they do recommend resting for 1 to 3 days. I think that's a little bit excessive when it comes to rest. And then the next thing for the I is ice. Icing can be good for injuries. It can also do some detriments if you do it too much. So we'll kind of go over how much is appropriate for icing and how much is not so appropriate. And then the C for Rice is compression. I like to use these voodoo bands here in the office to compress the injury. That's going to control some of the swelling, and then I'll actually take the compression off, and we're kind of flushing new blood flow to the area. And then the E in Rice is elevate. So getting your ankle above your heart for recommended is 2 to 3 hours total throughout the day, so you don't have to live with your ankle above your heart. And we'll kind of go a little bit more into that here in a minute. Yeah, so that's Rice. That's kind of the what everybody knows and what a lot of people still recommend, and it works pretty well. But there are some things that are more beneficial to the new acronym, which is Peace and Love. Peace stands for so P is going to be protection. That's going to be using something to restrict or unload the tissues. A lot of people will use an ankle brace or they'll use an ACE bandage, which is totally fine. This helps control the bleeding. It also helps control the re-aggravation of injuries, so you're not likely to sprain the ankle again in the beginning, which can make things worse. It works really well because it provides that support. We do want to eventually get out of the ankle brace so that we can maintain some structural integrity of the muscles and the soft tissues that have been damaged. With the protection phase, you want to kind of follow your symptoms. When you're in a ton of pain, having that brace on there initially is going to help quite a bit. Over time, you do want to transition out of the brace as things become less painful. We don't want to use that brace as a crutch. That can cause kind of more instability problems going down the road in an ankle or a knee. And then in the Peace method, E is also elevate. So P, protect, E, elevate. Same concept apply to Rice. We're going to elevate. Don't do anything more than 2 to 3 hours throughout the day, the 24-hour period. You can do 20 minutes at a time. Not everybody has 2 to 3 hours to just kind of lay with their foot up. And then the A in Peace stands for avoid anti-inflammatory modalities, which is a new one for me. They actually do recommend avoiding ice for long terms. Ice can reduce inflammation, but with acute injuries, we actually want some level of inflammation to come in because we're bringing in macrophages and neutrophils. Those are cells that are going to kind of help repair and clean out debris from that injury. And along with that is avoiding ibuprofen or other non-steroidal anti-inflammatories, just because it's going to help. It's going to disrupt the inflammation process, and we do need some level of inflammation coming to the area. Ice is really good for pain. So typically, like, to use ice as an analgesic or a pain management thing, you want to do about 10 minutes total. 5 minutes, you can start to feel that pain relieving effect, which is going to be very good. Yeah, and then we're moving on to the C in peace, and that's for compress, just like with rice. Like I said, I use this voodoo floss. You can use an ace bandage. That's going to compress the ankle and reduce any further swelling or edema, or even kind of tissue hemorrhage. If there's bleeding on the inside, it's going to help with that vasoconstriction. Something I will note, so inflammation, swelling, they're not necessarily synonymous terms. They mean different things in different acute injury type phases, you know, because we hear about like chronic inflammation throughout the whole body, which is that's not good, but inflammation for an ankle sprain that's repairing is an okay thing. That's compress. And then E is going to be educate in the peace method. What they do recommend is load management. So if you can tolerate putting weight on that ankle, you're supposed to put some weight on that ankle. If you need to use crutches for a little bit to get around, that's okay, but slowly start to add more weight-bearing activities and exercises to that painful area, to that ankle, just so that you're not going to lose any kind of muscle strength and stability. That's going to help reestablish proprioception in the ankle. Proprioception is just how we keep things stable in space and where our body is at in space. And then we're getting on to the love side of the acronym. So peace, protect, elevate. A is anti-inflammatory, C is compress, and then E is educate. And then love, we're going to start with the L, that's load. Load is going to be different exercises or weight-bearing type stuff. The peace, I should say that peace is good in the initial stages of the injury, and then love is going to be like 3 days and after. So that's going to be the early stages of rehabbing that ankle sprain so that things don't become chronic. So load with soft tissue injuries is huge. Load can be anything from weight bearing to exercises to just kind of gentle movements. We want that load so that tissues don't become stiff or things don't become fibrotic. We want to keep some motion in the ankle joint. And then O is optimism. A lot of things that can slow down our healing process or even cause more chronic kind of ongoing type pain is when we catastrophize. Like, it's not fun to roll an ankle, especially when it swells up like a balloon. It's like, oh my gosh, this is the worst thing ever. Like, I'm never going to be able to play soccer again or basketball. That's not helpful. Tissues heal. Sometimes they just take a little time. So being optimistic with your rehab process and fixing the problem process is huge. And then we need to control the depression and fear. So a lot of people, they'll stop doing something because they fear that they're going to roll the ankle again, or that they fear that they're going to make the problem worse. The only way you can really make the problem worse is getting back into what you like to do too soon, or not taking the steps and stages of rehab to really build tissue tolerance back up and fully heal the tissues so that they're ready to go for activity. And research actually shows that if you maintain optimism throughout the rehab process, you don't catastrophize, you don't have fear, you don't have depression about not being able to do the thing, you have better outcomes and faster outcomes for that injury. Okay, and then the V part of love is vascularization. Cardiovascular activity is going to be great when it's pain-free. So if you roll the ankle and you can do some light biking, that's going to bring all kinds of new blood flow to the area. That's going to help keep some structural integrity with the muscles that have been injured. And we want that to be relatively pain-free because we don't want to go kind of poking the bear of pain every so often. And then the benefits of early mobilization aerobic exercise, they have better outcomes in function, better improvement with work status, and reduces the need for pain medication. So reducing any kind of need for pain medication is going to be huge. And then the E part of love is exercise. So vascularization is going to be good to bring blood flow, and then we need exercises to strengthen the muscles. That's going to be like with ankles, for example, a lot of proprioceptive type stuff initially, and we're also going to try to restore range of motion initially so that we're not limited and the ankles don't become super stiff. And then the exercise is the best, is probably the most important part, and it needs to be started relatively soon after an ankle sprain, depending on the severity. Getting any kind of motion in your foot after an ankle sprain is going to be good. Just doing some simple gas pedals and even like slow controlled ankle circles are going to be helpful as well. That won't necessarily prevent further ankle sprains and injuries. Different exercises are going to be good for that, but in the early phases where you're just trying to mobilize the ankle and keep things moving so that tissues don't become super stiff, it is going to be very important. So remember, peace and love, protection, elevation, avoidance of anti-inflammatories, compression, and then education, getting up, getting moving, and then love is load, optimism, vascularization, and exercise. So if you guys have any questions, feel free to reach out to us. If you have any ankle sprains or acute injuries, follow those guidelines of peace and love. Rice is fine to do, but peace and love might just be a little bit better because ice does tend to feel pretty good as a pain reliever, and if that keeps you from taking ibuprofen or any other non-steroidal anti-inflammatory, which could slow down the healing process, that's okay. Just as long as you're doing it for 5 to 10 minutes, you're going to get the benefits of ice. And if you have any ongoing things, feel free to reach out and schedule an appointment with us. We can usually point you in the right direction and get things feeling better and get these problems fixed so you can get back to doing what you love to do. And do we have any questions?
Can you use peace and love with any acute injury, or is it specific to just like joint injuries? So
you can use it you can apply the same principles to any injury. Like with acute low back pain, acute neck pain, so pretty much any injury.
How does the floss work?
Okay, the floss. So I will kind of demonstrate on myself. I'm just going to do it on my calf. So with the floss, we're going to be compressing the tissue, and that's going to slow down the blood supply for a little bit. I like to use the floss before exercise, so if my knees feel stiff or before I'm doing some squats or exercising, I will start away from the heart, so farthest away from the heart, and then you want to wrap kind of half over the top of itself, always wrapping toward your heart. That's going to make it so blood doesn't pool away from the compression that we're having. We're trying to shut it off and have it come up this way. So we're going to go here and just wrap the knee. Right now, this compression, the muscles, they like the compression. It feels good. And then I don't just leave it here. I like to have people either do some like air squats, do some lunges, or just even standing up and mobilizing the knee a little bit. The compression's good for the muscle, but also tricks the joint into feeling more stable than what it is, which can help just decrease the sensation of pain. And then we're going to take that off. After I do that for about 30 seconds, take it off nice and quick. And then I like to recheck what was ever painful or stiff. So I'm getting there. I didn't have it on for very long, but my right knee feels way looser and ready to move than my left knee. So I would wrap my left knee right after that. Hopefully that answers that question.
Yeah, perfect. That is all the questions I see, so I think we are good.
Perfect.
All right. Thank you so much, everyone. And we will see you next Doc Talk Tuesday.
Have a good day.